As we age, our bodies and minds undergo significant changes. These changes often lead to habits or behaviors that might not be immediately apparent to the person experiencing them but are easily noticed by others. Some of these habits can be unsettling, not because they are inherently negative, but because they often mark a shift in one's lifestyle or personality. In this video, we'll explore the most common habits that develop in old age that others notice but don't openly discuss. 1. Repetition in conversations. One of the most common habits that older adults develop is repeating themselves during conversations. This might happen due to memory lapses or cognitive decline, where the individual forgets they have already mentioned something. While they may not realize they've repeated themselves, those around them often notice and may feel uncomfortable addressing the issue. The repetition can also stem from a need for reassurance or a desire to feel connected with others. For family members and friends, it's important to be patient and understanding, offering gentle reminders without making the person feel embarrassed. 2. Slower movement and physical limitations. Aging often brings physical limitations that affect mobility. While people may not notice the gradual decline in their own strength or agility, others certainly do. Slower walking, difficulty climbing stairs, or needing assistance with everyday tasks can become more noticeable as the years go by. These changes are sometimes difficult for older adults to accept, as they may still feel capable and independent, but it is clear to others that they are not as physically capable as they once were. 3. Less emotional control. As people age, they sometimes find it harder to regulate their emotions. This can result in more outbursts of anger, frustration, or even tears over situations that once wouldn't have elicited such strong reactions. These emotional shifts can be noticed by loved ones, who may wonder why their older family members are reacting in ways that seem out of character. Hormonal changes, neurological shifts, or the cumulative stress of life can all contribute to these emotional fluctuations. It's important for those around the elderly person to approach these emotional moments with empathy and understanding. 4. Increasing social withdrawal. Another noticeable change in older age is the tendency to become more socially withdrawn. Older individuals may begin to avoid social gatherings or activities they once enjoyed. This can be due to a variety of reasons, such as physical discomfort, the loss of close friends, or a feeling of being out of place in younger social circles. While some people may be content with their solitude, others may feel isolated and lonely, yet are reluctant to express this. Social withdrawal is often an indicator of underlying feelings of sadness or depression, and loved ones should encourage connection while respecting the individual's space. 5. Changes in grooming habits. With aging often comes a shift in how individuals care for themselves. This can manifest as a decline in personal grooming, such as not taking regular showers, neglecting hair care, or dressing in outdated or mismatched clothing. For some elderly people, the effort to maintain their appearance becomes less important as they prioritize comfort and ease. Others may feel overwhelmed by the physical demands of grooming or lack the energy to maintain their usual routines. While it can be difficult for loved ones to watch these changes, it's important to offer gentle encouragement without making the elderly person feel self-conscious. 6. Forgetfulness and memory issues. Memory problems, whether mild or more severe, are a common issue for older adults. Forgetting appointments, names, or where they placed things can be frustrating for the individual and concerning for those around them. While forgetfulness can be a normal part of aging, it can also signal early stages of dementia or other cognitive impairments. This change can often be the most uncomfortable for family members, who may not know how to handle these lapses without causing distress or embarrassment. 7. Physical complaints without clear causes. Older adults often begin to express complaints about aches and pains that don't seem to have a clear cause. These physical complaints, such as joint pain, headaches, or stomach discomfort, might be the result of normal aging processes or health conditions, but they can be frustrating for those who don't see a clear reason behind them. Sometimes, these complaints are accompanied by a reluctance to seek medical attention, which can lead to concerns among family members and caregivers. It's essential to approach these complaints with sensitivity, recognizing the challenges of aging while encouraging regular medical checkups. Why do older people start to repeat themselves, and how does it affect their relationships? As people age, various cognitive, emotional, and physical changes can occur, and one of the more noticeable behavioral changes is the tendency to repeat themselves in conversations. This repetition can be unsettling for both the person experiencing it and those around them. However, it's important to understand that this behavior often stems from natural aging processes, such as memory lapses, cognitive decline, and emotional shifts. Let's dive into why older people start repeating themselves and how this can impact their relationships. The causes of repetition in older adults. 1. Memory decline. One of the most common reasons older individuals start repeating themselves is due to memory decline. As people age, it's not uncommon for their short-term memory to become less reliable. They might forget that they've already shared a particular story, fact, or piece of information during a conversation. This can be especially frustrating for family members and friends who have already heard the same thing multiple times. However, for the individual repeating themselves, it may not be immediately apparent that they've already spoken about the same topic. Cognitive decline, which can be a normal part of aging or a sign of conditions like dementia or Alzheimer's disease, also plays a role. These conditions affect memory, making it difficult to recall recent events or conversations. As a result, older people may unconsciously repeat stories or topics they've already discussed. 2. Emotional needs and reassurance. Repetition can also stem from an emotional need for reassurance or connection. As people grow older, they may experience feelings of loneliness or a sense of being forgotten. Repeating stories or asking for the same details again can be their way of seeking validation or simply trying to engage with others. They may feel more secure when they hear their own words reflected back to them, especially if their personal or emotional experiences are central to the repeated conversation. In this context, repetition is a coping mechanism rather than a symptom of cognitive decline. It's a way for older people to maintain a sense of control and engagement in their relationships, especially if they feel disconnected from the world around them. 3. Anxiety and cognitive load. As people age, their ability to process information quickly may slow down. This can lead to cognitive overload, where an individual finds it harder to keep track of multiple conversations or topics at once. To manage this, they might repeat themselves as a way to process information or ensure they're communicating something important that they don't want to forget. For some, this could also be linked to anxiety. The fear of losing control over memory or conversation might lead to repeating themselves as a way of locking in important thoughts. 4. Social isolation. Older adults who are isolated or have fewer opportunities for social interactions may find themselves repeating stories out of a lack of fresh conversational material. The absence of regular social exchanges can lead to a desire to share the same stories over and over again. They may seek to revisit cherished memories that bring comfort and familiarity, especially if they don't have many new experiences to share. How repetition affects relationships. While repetition can be a normal part of aging, it can also place a strain on relationships, especially if it becomes a frequent or noticeable issue. Here's how repetition can affect relationships. 1. Frustration and irritation. For family members or friends who are frequently exposed to repeated stories or information, frustration can arise. Hearing the same thing over and over can be tiresome, especially if the person feels like they have already responded or acknowledged the repeated content. This frustration can lead to irritation, which may cause tensions between the older adult and their loved ones. It's crucial for caregivers and family members to exercise patience in these situations. However, it's also important to acknowledge that this behavior is rarely intentional or malicious. The older person is not repeating themselves to annoy others, they are simply responding to changes in memory or emotional needs. 2. Feelings of guilt and avoidance. Family members and friends may start to feel guilty or uncomfortable about the repetition. They may worry that their loved one is experiencing cognitive decline or that they are being dismissive by not acknowledging the repeated content. This guilt can lead to avoidance, where individuals might spend less time with the older person, not because they don't care, but because they don't know how to handle the repetition. Avoidance, while often unintentional, can hurt the older individual's feelings, leading to more isolation and emotional withdrawal. This creates a cycle where the person repeats themselves more due to the lack of interaction, further exacerbating the situation. 3. Impact on the older person's sense of self. For the elderly person, the act of repeating themselves can sometimes trigger feelings of embarrassment, confusion, or even shame. They may notice that their loved ones seem frustrated, or they may sense that their stories aren't being heard in the way they once were. This can lead to a diminished sense of self-worth and a reluctance to communicate, which in turn exacerbates the isolation they may already feel. Older adults may also feel that their identity and life experiences are being disregarded when their stories are dismissed or ignored. This can hurt their emotional well-being, as they are trying to maintain connections through the repetition, even though it may not be understood by others. 4. Communication breakdown. In some cases, repetitive conversations can cause a breakdown in communication. If an older adult begins repeating the same points without acknowledging the responses or feedback they've received, it can become difficult for others to engage in meaningful dialogue. This can strain family dynamics, particularly if there is no clear understanding of the reasons behind the repetition. How to handle repetition with patience and understanding. While repetition can be challenging, it's important to approach it with empathy. Here are a few tips for managing repetitive conversations. Listen actively and with patience. Even if you've heard the same story before, try to listen attentively and respond in a way that shows you value the conversation. Gently remind them if needed. If the person is repeating themselves and seems unaware, kindly remind them of the previous conversation without making them feel embarrassed. Provide emotional support. Offer reassurance that you enjoy hearing their stories and that they are important to you. Encourage engagement. Help your loved one stay engaged in conversations by asking open-ended questions or introducing new topics to discuss. By being mindful and compassionate, you can help ease the challenges that come with repetition and maintain strong, supportive relationships with older adults. What physical changes in old age often go unnoticed by the person but are evident to others? As people age, their bodies undergo a series of gradual changes. Many of these changes are subtle and may not be immediately noticeable to the person experiencing them, but they can be highly visible to others. These physical transformations are a natural part of aging, but they can affect how individuals are perceived and how they perceive themselves. Let's explore some common physical changes in old age that often go unnoticed by the person but are evident to those around them. 1. Changes in posture. One of the most common yet overlooked physical changes in old age is a shift in posture. As people age, the muscles and bones of the body weaken, and the spine may begin to curve. This can lead to a stooped or hunched appearance, often referred to as dowager's hump or postural kyphosis. The person experiencing this change may not immediately notice it, especially if it occurs gradually, but it is usually very noticeable to others. This change in posture can affect not only how a person looks, but also how they feel physically. It may contribute to back pain or a decrease in mobility, and it can alter the way others perceive the person's confidence or energy. While older adults might not notice these small shifts in their body, friends and family may be able to spot the change in posture and offer support or assistance to help with any discomfort. 2. Skin changes. The skin is one of the most visible areas where aging takes its toll. As people age, the skin loses collagen and elasticity, which results in wrinkles, sagging, and thinning. The skin may also become more fragile and bruise easily. Older adults may not notice the gradual changes in their skin's appearance, especially if it happens over time, but others are often quick to see the differences. Age spots, dry patches, and increased visibility of veins can also become more pronounced in older adults. These changes are part of the natural aging process, but they can make a significant impact on the way others perceive someone's age. For the person experiencing these changes, it can be difficult to recognize the transformation, but it's often evident to those they interact with regularly. 3. Slower movement and reduced agility. As people age, their muscles and joints naturally lose strength and flexibility, making movements slower and less agile. This physical change can be difficult for older adults to recognize since it happens gradually over time. However, it's typically very noticeable to others. When an older adult struggles with tasks that used to be easy, such as getting up from a chair, walking, or climbing stairs, it's apparent to others that their movement has slowed down. This reduced agility may also lead to a more cautious or deliberate way of moving, and others might notice a change in how the person walks, with a more shuffling gait or the use of a cane or walker. While the person experiencing the change may not immediately notice the difference, it can have a significant impact on their daily life and on how they are perceived by others. 4. Changes in weight distribution. In older age, body fat tends to redistribute. Many people notice that their weight increases around the abdominal area while their limbs become thinner. This redistribution can be due to hormonal changes, muscle loss, and changes in metabolism. Older adults may not immediately recognize these changes because they occur slowly over time, but to others, the shift in weight distribution can be quite noticeable. The reduction of muscle mass and the increase in body fat can affect a person's physical strength, balance, and overall posture. In addition to changes in weight, older adults might experience a decrease in height due to the compression of their spine, which can further alter their appearance. 5. Changes in hair texture and color. One of the most obvious and noticeable signs of aging is the change in hair texture and color. As people age, the production of melanin, the pigment responsible for hair color, decreases, leading to gray or white hair. In addition to color changes, the texture of hair can also change. Hair may become thinner, finer, and more brittle as the follicles lose their strength. While older adults may notice a few gray hairs, the full extent of the change can often go unnoticed until they see themselves in a mirror or their hairdresser comments on it. For those who experience hair thinning or loss, the change can be subtle and gradual, but others may see the transformation more clearly, especially if they haven't seen the person in a while. 6. Reduced facial expression. As people age, their facial muscles can lose tone, which can reduce the range of facial expressions. The skin may become less elastic, and the underlying muscles may weaken, causing the face to appear less animated or expressive. This can result in a more neutral or even serious expression, even if the person is not intentionally conveying those emotions. The person experiencing this change might not be aware of it, as the process happens gradually. However, others may perceive the lack of facial expression as a sign of sadness, detachment, or disinterest. This change can be particularly noticeable in social interactions, where facial cues are essential for conveying emotions and engagement. 7. Hearing and vision decline. Although hearing and vision decline are often discussed as cognitive or sensory changes, they can also be physically evident in older adults. People may start to speak louder because they can't hear themselves as clearly, or they might strain to read small print or avoid eye contact when they have trouble seeing facial expressions. These changes are often imperceptible to the person experiencing them, as the decline tends to happen gradually. However, to others, the changes in communication style or the need for assistive devices like hearing aids or reading glasses can be very noticeable. These changes can impact daily life, making it more difficult for older adults to engage in conversations or perform routine tasks that rely on their senses. 8. Decreased fine motor skills. As people age, the fine motor skills needed for tasks like buttoning a shirt, tying shoes, or using utensils may begin to deteriorate. This decrease in dexterity can go unnoticed by the individual, as the changes are subtle and slow. However, others might see these difficulties when the older adult struggles with tasks that once seemed easy. The loss of fine motor skills can also affect other aspects of life, such as writing or typing, leading to a decrease in independence. While the person may not recognize the gradual decline, loved ones might notice that certain tasks take longer or are no longer performed as efficiently. How does aging impact people's ability to manage their emotions, and why do they sometimes act out? Aging is a natural process that affects not just the physical body but also emotional and psychological well-being. As people grow older, they may face changes in their ability to manage emotions, which can sometimes lead to emotional outbursts or acting out in ways that seem unusual or unexpected. Understanding the connection between aging and emotional regulation is essential in appreciating why older adults may react differently than they did in their younger years. 1. Cognitive changes and emotional regulation. As people age, their cognitive functions may decline. This can include changes in memory, processing speed, and executive function, the brain's ability to plan, organize, and regulate behavior. These cognitive changes can make it more challenging for older adults to manage their emotions as effectively as they once could. For example, when memory declines, older adults might forget important events or conversations, leading to frustration or confusion. Cognitive impairment can also affect judgment and decision-making, which can result in emotional reactions that seem disproportionate or out of character. When the ability to filter emotions or think through a situation is compromised, it may lead to impulsive reactions or emotional outbursts, even in situations where the individual might have previously managed emotions with greater control. 2. Physical changes and emotional impact. Alongside cognitive changes, aging brings physical changes that can affect emotional regulation. Chronic pain, reduced mobility, and the general decline in health can lead to feelings of frustration, helplessness, and sadness. For older adults who experience a loss of independence due to physical limitations, these challenges can have a profound emotional impact. It's common for those facing physical decline to feel more vulnerable, which may lead to irritability, mood swings, or difficulty coping with stress. Additionally, the changes in brain chemistry that come with aging, including the decline in levels of serotonin, dopamine, and other neurotransmitters, can also affect emotional stability. This neurochemical shift may make it harder for older adults to experience the same sense of emotional equilibrium that they did earlier in life. When these brain chemicals fluctuate, it can result in increased anxiety, sadness, or irritability, which might manifest as emotional outbursts or behavior that appears acting out. 3. Emotional resilience and life experiences. One of the most interesting aspects of aging is the accumulation of life experience. Older adults have had years of personal growth, emotional highs and lows, and they've faced many challenges over the years. This can make them more emotionally resilient, in the sense that they may have developed coping strategies for difficult situations. However, as they age, they might find that the emotional challenges they encounter now are harder to manage, particularly when faced with new losses or significant life changes. Loss of loved ones, retirement, or changes in social roles can trigger feelings of grief, loneliness, or a sense of purposelessness. These feelings can challenge an older adult's emotional resilience, causing them to act out in ways they might not have in the past. For instance, an older person who has previously been composed in social settings might suddenly withdraw or express frustration when dealing with their own emotional challenges. Emotional responses, such as anger or sadness, may be more intense because the individual feels overwhelmed by life's changes. 4. Social isolation and emotional outbursts. Aging often brings about a sense of social isolation, particularly if an individual's circle of friends and family members decreases due to death or relocation. Isolation can lead to feelings of loneliness, depression, and a sense of disconnection from others. As emotional support becomes more limited, older adults may struggle to manage their emotions effectively. Social isolation can contribute to acting out because the individual lacks the usual outlets for expressing and processing their feelings. Without frequent social interactions, older adults may feel misunderstood or ignored, and this can lead to emotional frustration. Acting out could be a cry for attention, a desire for connection, or an attempt to express feelings that have been suppressed for too long. Furthermore, when emotional needs aren't being met due to isolation, people may experience a loss of hope, resulting in emotional outbursts or withdrawal. 5. Loss of control and feelings of vulnerability. As individuals age, they may feel a sense of losing control over their lives. Changes in physical appearance, cognitive function, and daily capabilities can lead to feelings of powerlessness. In response to this vulnerability, older adults might act out emotionally in an attempt to regain some sense of control. For example, they may become more demanding or stubborn when it comes to making decisions or asserting themselves in situations where they feel their autonomy is being threatened. Additionally, older adults who feel that they have little control over their environment might become frustrated with the changes happening around them. This frustration can be expressed through irritability, anger, or even aggression. These emotional responses are often rooted in fear, fear of decline, fear of being forgotten, or fear of losing their sense of self. 6. Depression and anxiety in older adults. Depression and anxiety are common in older adults and can significantly impact their emotional regulation. The loss of loved ones, major life transitions, and physical decline can contribute to the onset of depression or exacerbate existing mental health conditions. The symptoms of depression in older adults can sometimes manifest as irritability, anger, or acting out, rather than sadness or withdrawal. Anxiety, on the other hand, can cause restlessness, excessive worry, and emotional outbursts, especially when it relates to concerns about health, financial stability, or independence. Older adults who experience depression or anxiety may have difficulty controlling their emotional responses, leading to behaviors that others might interpret as acting out. 7. Lack of emotional support or coping mechanisms. Many older adults may struggle with the lack of emotional support as they age. The loss of a spouse or close friends can leave them without the emotional connections they once relied on for support. Additionally, if they haven't developed healthy coping mechanisms throughout their lives, they may find it difficult to manage complex emotions like grief, frustration, or fear. Without proper outlets for expressing these feelings, the individual may act out in ways that reflect their internal emotional struggle. How do changes in speech patterns in old age affect communication with others? As people age, their bodies undergo a variety of changes, including modifications to speech patterns. These changes, which may be subtle or more noticeable, can have a significant impact on how older adults communicate with others. Alterations in speech can influence clarity, pace, tone, and even the emotional tone of conversations, which in turn can affect relationships, social interactions, and overall quality of life. Understanding these changes is crucial to fostering better communication with older adults and maintaining strong connections. 1. Slower speech pace and increased pauses. One of the most common speech changes in older age is a slowing down of the speaking pace. As people age, their cognitive processing speed may decline, which can result in slower articulation of words. This can lead to pauses in conversation as they take extra time to gather their thoughts or recall information. While these pauses are a natural part of aging, they can sometimes be misunderstood by others, especially if they are unfamiliar with this aspect of the aging process. For the listener, slower speech might create a perception of reduced mental sharpness or a lack of confidence. However, these changes are not always indicative of cognitive decline. In fact, slowing down speech can actually be a deliberate strategy to enhance clarity, allowing the speaker to articulate their thoughts more precisely. For family members and caregivers, it's important to be patient and avoid interrupting, giving the speaker ample time to express themselves without feeling rushed. 2. Changes in pitch and tone. As individuals age, changes in the vocal cords and respiratory system can lead to alterations in pitch and tone. The vocal cords may lose elasticity and become thinner, leading to a higher-pitched or weaker voice. Some older adults may develop a breathy or raspy quality to their voice, which can affect how their words are perceived. These changes in pitch and tone can sometimes be misunderstood by listeners. For example, a higher-pitched voice might be interpreted as being weaker or more fragile, even if the speaker feels confident and strong. Alternatively, a raspy or hoarse voice might be associated with illness, making listeners worry about the speaker's health. In some cases, these vocal changes can lead to frustration for the speaker, especially if they feel their voice is no longer being heard clearly or with the same authority it once had. 3. Word finding difficulty and repetition. Older adults may experience challenges with word recall, which is a common part of aging. This can result in speech that includes frequent pauses, use of filler words, or even repetition of phrases. People might find themselves searching for the right word or repeating a sentence because they have forgotten what they intended to say. While occasional difficulty finding the right word is completely normal, frequent occurrences may lead to embarrassment or frustration for the older person. For listeners, it might cause confusion or lead to assumptions about cognitive decline. However, it's important to remember that these struggles are often just part of the normal aging process and do not always indicate a significant cognitive issue. Listening with patience, offering support by helping to find the right word, and not rushing the conversation can ease the stress for the speaker and improve communication. 4. Reduced volume and projection. As people age, they may experience changes in the muscles involved in speech, resulting in a softer or less forceful voice. Reduced volume can make it harder for others to hear the speaker, especially in noisy environments. Older adults may not always be aware of the decrease in their vocal strength, and this can lead to frustration on both sides of the conversation. When the volume is too low, listeners might struggle to understand the speaker, leading to repeated requests for them to speak louder. This can be tiring and discouraging for the older person, who may feel their ability to communicate effectively is diminishing. Encouraging clear communication techniques, such as speaking directly into the listener's ear or using amplification devices, can help mitigate these issues. 5. Monotony and flat effect. Another common change in speech patterns in older age is a tendency toward monotony in voice tone. This occurs when the speaker's voice becomes less varied in pitch, rhythm, and emphasis. This shift can make speech sound less expressive, which can affect how emotions are conveyed through language. A lack of tonal variation may make the speaker appear uninterested or disengaged, even if that is not the case. For family members and friends, it's important to understand that this monotony is often a physical result of aging and not a reflection of the person's emotional state. Encouraging open, supportive conversations and giving the speaker opportunities to express their thoughts and feelings can help combat the effects of a flat effect, making communication feel more connected. 6. Cognitive decline and speech disorders. In some cases, older adults may experience more significant changes in speech due to cognitive conditions like dementia, Alzheimer's disease, or stroke. These conditions can impair the ability to form coherent sentences, understand language, or recall words. In such cases, speech patterns may become disjointed, repetitive, or nonsensical. When these more severe changes in speech occur, it can be challenging for both the speaker and the listener. The speaker may become frustrated by their inability to communicate effectively, while the listener might struggle to understand what is being said. However, even in cases of cognitive decline, communication can often be improved with patience, understanding, and nonverbal cues such as touch, gestures, or facial expressions. 7. Social and emotional impact of speech changes. The changes in speech that come with aging can have a significant emotional impact on older adults. Communication is a key part of social interaction, and difficulties with speech can lead to feelings of isolation, frustration, or embarrassment. Older individuals may become self-conscious about their speech patterns, which can make them less likely to engage in conversations or participate in social settings. This withdrawal from communication can exacerbate feelings of loneliness and contribute to social isolation. It's important for caregivers, family members, and friends to offer emotional support and encourage ongoing social interaction. By being patient, empathetic, and proactive in addressing any communication challenges, loved ones can help the older person feel more confident in their ability to communicate effectively. Changes in speech patterns are a natural part of the aging process, and they can affect communication in various ways. Slower speech, word-finding difficulties, changes in pitch and tone, reduced volume, and other alterations can influence how older adults interact with others. While these changes may cause frustration or misunderstanding, they do not necessarily indicate cognitive decline or loss of mental sharpness. With patience, understanding, and support, communication can remain effective, allowing older adults to continue to express themselves and maintain meaningful connections with others. Being aware of these changes and adjusting communication strategies can significantly improve relationships and quality of life for aging individuals.